Hi everyone, Dr. Wayne Saltsman, geriatrician and elected member of the Burlington Board of Health, coming to you once again to help you stay informed, be prepared, and feel supported during this time of COVID-19. Lots of stuff continuing to go on in our world around this pandemic, and some things I'd like to talk to you about. But first, as always, the numbers. 2.8 million confirmed cases of COVID-19 around the world, but 745,000 recoveries. 870,000 cases in the United States, but 81,000 recoveries. And 195,000 folks have been tested in the state of Massachusetts, and testing is still ongoing, as we all know. Now, there's been a lot of talk about medications or cures or interventions for COVID-19. I know people are becoming somewhat impatient, wondering what's going on. And all I can tell you is that when it comes to science, it's not something that moves as quickly as we would like it to. But science, science, science is the key. We know that some medications that have been espoused as being successful haven't quite worked out. But there are clinical trials underway with medications that might help. People are wondering when the vaccination is going to come about. And there's been talk about a year or sometime next year. And those are probably true because remember, it's not so much creating the vaccine, it's making sure that it's safe, it's making sure that it can be produced in large quantities, and it's making sure that it's effective. And these things do take time. So have patience. There are people who are already working on the safety aspects, and there's testing going on regarding a potential vaccine across the world. I was very concerned yesterday to hear our governor's report regarding our current status of hospitalizations across the world. Not because there were so many people with COVID-19 in the hospital, but because people who would benefit from coming to the hospital were staying at home, becoming much more ill, and by the time they were getting into the hospital, some serious interventions had to be taken that might not have been needed had people come sooner. I know that there's this concern about going to the hospital because that's where COVID-19 is. But our hospitals across the state have made plans to make sure that COVID-19 is separated from people who don't have COVID-19. So if you feel ill, if you feel that the emergency room is the right place for you to be, and you would have thought that before COVID-19, do not let thoughts about COVID-19 cloud your judgment. If you need to go to the hospital, if you feel you need to go, please go. Please let people help you. It's the best thing that we can do is to make sure that we aren't at home becoming more ill when we could actually be helped if we went to the hospital earlier. So please go if you feel you need to go. Otherwise, recommendations have not changed. If you're out in public, please wear a mask. Be a good citizen. Be part of the solution. Hand washing, hand washing, hand washing, more important now than ever before. Cleaning off your surfaces. Social distancing. If you want to go outside, but be responsible in how you interact with other members of our community. Be patient. Things that are talked about with regard to possible interventions need science behind them. Be patient for that science to happen. People are trying to find a cure, trying to find a vaccine, trying to help us all get back to a normal work life. If you know an older adult who could benefit from a phone call, please make one. We're all in this together. Be safe. Be well.